Hello, I'm Dr. Chardell Spriggs, manager of the NIH CounterACT program, here to describe a new CounterACT research opportunity. It is the CounterACT Early Stage Investigator, or ESI, Research Award. We are inviting applications from ESIs to pursue exploratory and developmental research projects of interest to our program through an extended R21 mechanism that will give an enhanced level of funding support over typical R21s without endangering your ESI status. The NIH CounterACT program has supported research since 2006. It is a congressionally mandated program charged to increase the scientific knowledge base of chemical threats and identify and develop effective therapeutics to decrease morbidity and mortality in the event of a mass casualty civilian exposure to these highly toxic chemicals. You may find more information on our website listed here. The civilian chemical threat spectrum includes chemical warfare agents, toxic industrial chemicals, pesticides, pharmaceutical-based agents, and other chemicals. The CounterACT program is restricted to funding research on chemicals that are included on the current Department of Homeland Security list of chemicals of concern, which is for U.S. government official use only and cannot be disseminated. The list of over 200 chemicals can be categorized into toxidromes that group chemicals based on their mode of action. This not only gives you an idea of the kinds of chemical threats, but medical countermeasures developed for one chemical may also be effective for another chemical threat in that same category. The chemical threat toxidromes are listed here with some examples. While we cannot at this time share the list, we are able to discuss it with you in detail. We urge all applicants to contact the NIH program staff listed at the end of the presentation to confirm that the chemical or chemicals they wish to study are on this list before developing an application. The CounterACT ESI R21 is a one-time funding opportunity announcement. It has only one receipt date, and that is on July 27th, 2021. Review will occur in October, with awards released in March of next year. There are several advantages over a typical R21, including providing 3 years of support and up to $400,000 in direct cost. No more than $200,000 in direct costs may be requested in any single year. Most importantly, ESIs that successfully compete for this enhanced R21 will not lose their ESI status and benefits afforded to them when competing for other grant mechanisms from NIH, such as R01. All applicants to this funding opportunity announcement must meet the definition of an NIH early stage investigator. That is an investigator who has completed their terminal research degree or postgraduate clinical training within the past 10 years and has not previously competed successfully as a principal investigator for a substantial NIH independent research award, such as a R01. The NIH encourages applications from underrepresented groups in the biomedical, behavioral, or clinical research workforce, such as women, individuals from underrepresented racial and ethnic groups, those with disabilities, and those from disadvantaged backgrounds. If you are submitting a multiple principal investigator application, all principal investigators must fit the NIH ESI definition. For this funding opportunity announcement, no preliminary data are required, expected, or encouraged. Preliminary data are unpublished data that are specifically defined as material which the applicant has independently produced and not yet published in a peer-reviewed journal or preprint that has a digital object identifier or DOI. You are limited to a half page of preliminary data, and that limit includes one figure. So altogether, the data, one figure, and legend must all be kept to a half page or less. If you exceed this limit, the application will not be reviewed. You may use published literature to justify and substantiate your application. You must unambiguously identify each occurrence of published literature that is included with an adjacent citation. Please pay close attention to the directions in the funding opportunity announcement. If the application is submitted without following all instructions, then it is non-compliant. It is non-responsive if the research is not appropriate for our program, and the application is ineligible if the applicant does not qualify for the funding opportunity announcement. Here is a short list of several examples we have focused on in this webinar that will cause an application to not proceed to review. And they are exceeding the preliminary data limit of having more than one half page of unpublished data. This will deem your application non-compliant. The CounterACT program is charged with developing therapeutics for the civilian population. Therefore, application proposing research that focuses on pretreatment or on a chemical that is not on the list of chemicals of concern are non-responsive. And also, only early stage investigators are eligible for this funding opportunity announcement. The scope of activities supported under the R21 mechanism is quite broad and includes, but is not limited to basic mechanistic research to identify molecular mechanisms of acute toxicity, creation and validation of screening assays, animal model development, identification of therapeutic targets and biomarkers, and the development of proof of principle efficacy data for candidate therapeutic compounds. Some recent changes at NIH need special attention. Please read the specific notices listed here on enhancing and implementing rigor and transparency in NIH-funded research. Pay close attention to describing scientific premise, which is now rigor of the prior research, specifically the quality, including strengths and weaknesses of the evidence from any data you present and the literature. Include a rigorous experimental design, address sex as a biological variable. If you cannot use both sexes or you see no need to, have a good explanation why not. Too expensive is usually not an acceptable reason. Address biohazards, containment and disposal of, as well as authentication of key agents used in your research, including the chemical threat agent. Saying you purchased something from Sigma or other supplier is not sufficient. You will need to run an analysis to verify the identity and purity of key compounds. Emphasis here is on key agent and does not include minor reagents and buffers. Do not use the vertebrate animal section for experimental details to circumvent page limits. The reviewers are not required to consider this section for that purpose, and this may result in less enthusiastic review scores. For the CounterACT program, practicality in real-world civilian mass casualty situations is important. This means the final product should have utility for emergencies involving acute chemical exposures where medical intervention is required immediately in the field or in hospital. Special consideration will be given to research relevant to subpopulations with higher vulnerability And we also encourage repurposing drugs already approved by the FDA. The CounterACT program offers several funding opportunity announcements that are progressive in nature in terms of funding support and maturity of research, starting at exploratory R21s such as this program. There are follow-on lead identification and optimization UO1 projects that can result in candidate therapeutics that progress to advanced development, which is outside the scope of the CounterACT program. R21 projects should generate preliminary proof of principle data that facilitates competitive applications for more extensive support, such as to the UO1 program. Take a look at the UO1 funding opportunity announcements and plan your R21 so that the data will meet or exceed UO1 entry criteria. The CounterACT program is truly a trans NIH effort because of the diversity of chemicals and their effects. Several NIH institutes participate in the program based on expertise needed to cover ocular, skin, pulmonary, and other effects of the chemicals we study. These include NINDS, NIAMS, NIEHS, NIDA, NEI, and NIAID that provides oversight and manages contracts. Each institute has a program officer assigned that can help you with specific scientific questions. If unsure, you may reach out to me for general CounterACT and funding opportunity announcement questions, and I can help point you in the right direction. We hope to hear from you soon, and thank you for your time.